Hello, I'm Dan Backens, and when I was about 45 years old, my world was rocked. I had a PSA reading that came in at about a 5.0, and I had a good physician who said, let's watch it for a while, and so we watched it for a couple of years, and at age 47, it had reached 9.0, and it had been a gradual climb over the years, and my physician said, I think we need to have a biopsy. So we took a biopsy, and the biopsy came back positive for cancer. I was 47 years old, and I had, quote unquote, the old man's disease. And I was a young father, I had 3 children. I'm a pastor by vocation, and my life was very active. And all of a sudden, I had to face this potentially life-threatening disease. It was at that time I investigated all the options that were available: radiation, seeding, surgery, etc. And after getting good counsel from men who had been through this before, I decided to go with surgery. And I didn't want to have the old-fashioned kind of surgery where you cut you wide open and there's blood everywhere, but I wanted laparoscopic surgery, which minimal amount of blood loss and the recovery rates are so rapid. So I looked for the doctor, and through some connections I found Dr. Krongrad. And after interviewing with him, he said he would be happy to be my surgeon. We interviewed and underwent surgery with him, and he told me what to expect. He had a great office staff. My fears were really lowered quite a bit, and I went into the surgery with great expectations. And just as he had said, I was only in the hospital one night, never did take any pain medication other than a couple of Tylenol. And I had some soreness, of course, in my abdomen, but nothing that kept me from eating and drinking and beginning to get a normal life back over time. Now, if you're a man that's watching this video and you're thinking about laparoscopic surgery for the prostate or any other method of healing it, you're probably wondering now, what about continence and what about the capacity for meaningful sexual activity? Well, let me give you the good news. Because of the skill of the doctor and the kind of procedure I had, both of those areas of erection and continence for my life have both returned to very good standards. I have no problem whatsoever with the continence. It recovered over about 2 to 3 months, little bit by little bit, and at about 8 weeks I didn't have any problem at all. And with the erection, I actually had some of my nerves needed to be taken in addition to the prostate, and I've recovered very, very well there too. And I'm very happy that I had that surgery. So I just want to encourage you, let this video be the kind of a video that lets you know that you've been diagnosed with something serious, but my experience was very positive, and the best days of my life are yet ahead, and I go weeks and weeks now without even thinking about what I had those 7 years ago. Hope this was helpful.